Hello, we're here at the Medi-Spa Knoxville Dermatology Group. I'm Brooke Bentley, nurse practitioner, and this is one of our patients and actually our staff member, Rita Wheeler. Today we're going to be talking about the new procedure that we're offering and we're very excited about, Kybella. So with Rita, over the years, you've had a problem with this area, correct?
Yes.
So you've had some submental fullness that you pretty much have had to deal with your entire life, no matter how much weight you lose. So it's more of a genetic issue for you, correct?
Mm-hmm.
When you have this problem here, you have this fullness of submental fat, it can be caused by three different things. One is it can be genetic, two, it can be weight gain, and then three, it can be simply from aging. Now we have a new product out on the market that can take care of this. It's a minimally invasive procedure, and it's called Kybella. Kybella is the first FDA-approved minimally invasive product that actually destroys that fat cell, and once it's destroyed, your results are permanent. So today we're going to be actually showing and doing that procedure on Rita. One of the things that I like to ask my patients is, do you have any kind of events or anything coming up that you need to clear your social calendar for? Because you do develop some swelling when you have this procedure done.
No, ma'am.
So we're good to go. As you can tell, Rita is already marked out because there are some areas that you want to stay away from. And what we're going to do is we're going to apply a temporary tattoo, which we call the grid, and that kind of shows us where we're going to be injecting the product. So Rita has already been cleaned off. I've already marked her areas. So I'm going to be placing this tattoo. And as I'm placing this tattoo, the only true contraindication that you could not have this procedure done would be if you had an infection at the actual injection site. And we'll just let that sit for 1 second. And there you go. So as you can see, there's a grid in this area that's going to show me where I inject the product. And then once we inject the product, she will have a little bit of swelling, a little bit of discomfort, just because there is an inflammatory response that takes place. One of the frequently asked questions is, am I going to have loose skin there in that area once the fat is dissolved? The inflammatory response that takes place does cause a retraction of that skin, so I haven't seen that problem with this procedure. So Rita has been applying ice to this area to decrease the discomfort, and I'm going to go ahead and get started. So as you can see, I use a very small needle to decrease the pain. And everywhere there's a little dot from this grid that we applied is where I'm injecting. We have injected all 23 areas and her Kybella treatment is complete. I do recommend that Rita have at least 2 to 3 treatments to tailor her results and optimize her outcome. As far as aftercare, we're going to apply ice immediately. Some things that Rita will have to stay away from: she can't exercise for 24 hours. She cannot have any alcohol. She wants to stay away from salty foods. Stay away from NSAIDs as far as Advil, ibuprofen, because you want the inflammatory response to take place. So for any discomfort or pain, she can take Tylenol. I will see Rita back in the office in about 7 to 10 days. And then her treatments will be about 5 to 6 weeks apart. And this is how quick and easy a Kybella treatment is.